is a tragedy that strikes the adolescent age the heaviest. It is important to know the facts, warning signs, and how to get help. Here are some stats of suicide prevention. Suicide is the second leading cause of death for college-age youth in ages 12 through 18. Most teenagers and young adults die from suicide rather than cancer, heart diseases, AIDS, birth defects, stroke, pneumonia, influenza, and chronic heart diseases all combined. Each day in our nation, there are an average of 5,400 attempts of suicide each day in grades 7 through 12. 4 out of 5 teens who have attempted suicide have given clear warning signs. Knowing the warning signs of suicide is critical. Some symptoms to be aware of are talking about suicide, making statements about feeling hopeless, helpless, or worthless, showing deepening depression, taking deathly risks or self-harming oneself, loss of interest in favorite activities, being a burden to others, withdrawing from activities, isolating family and friends, or acting recklessly.
It is important to know who is at risk. Those include perfectionist personalities, bisexual youth, those struggling to find sexual or gender identity, depressed adults and youth with low self-esteem, abused, neglected youth, parental history of violence, substance abuse, or divorce. Suicide is typically not a sudden onset. There are a number of stressors that can cause anxiety and or depression that can later lead to suicide, such as depression, mental illness, substance abuse, aggression and fighting, home environment, community environment, school environment, cultural factors, family history, or situational crisis.
Seeking treatment can be life-saving. People can find help and treatment from psychotherapies, electroconvulsive therapy, and medications for depression. And in case of an emergency, help can be found by calling the Suicide Prevention Hotline at 1-800-273-TALK, psychiatric hospital walk-in clinics, hospital emergency room, and urgent care centers or clinics, and lastly, calling 911.